Hello everyone, today we're going to be talking about grossing a hysterectomy specimen. So let's begin. Here we have the external surface of our hysterectomy specimen, and the first step before grossing is orienting what we have in front of us. So some of the key landmarks that we're using are our peritoneal reflections, and so on the anterior surface of our uterus, we will have a superior peritoneal reflection, which gives us this higher up looking flap of soft tissue. If we flip over to the posterior aspect, we can see that the peritoneum tapers down into a point and is more inferior on the posterior side. Other landmarks that we can use to orient a hysterectomy specimen include our round ligament, which should be anterior, our fallopian tubes, which should be slightly more posterior, and then our ovarian ligament and ovaries, which should be the most posterior. In this case, we do not have those structures to orient ourselves. However, we do have stumps of our round ligaments showing us what is anterior, and then stumps of our fallopian tubes will show us what is more posterior. So margins that we have in a hysterectomy specimen include our parametrial radial margin, which is right here, and that's where the surgeon cut around our bladder on the anterior surface, and then on the posterior surface, our rectum would be sitting immediately adjacent to the uterus. We also have our vaginal cuff or ectocervical margin, which is located here. So looking at the inferior portion of our specimen, we have our exocervix, and this is a pale tan, smooth surface. And in the center, we have our external os. Some shapes that we can see in the external os are round or slit-like, and in this case, I would describe it as being slit-like. As we open our hysterectomy specimen, we're going to start to notice other anatomical features. So in our cervical area, we have our endocervical canal. And then if we look a little bit higher up, we have our endometrial cavity, which is this triangular, congested, smooth area. To measure our hysterectomy specimen, we want to give overall dimensions in 3 dimensions. So we would be measuring in the superior to inferior plane, the medial to lateral plane, as well as the anterior to posterior plane. When we look down at our exocervix, we want to give this measurement in 2 dimensions. And then looking on the interior surface, we'll be looking at giving a measurement of the endocervical canal, and then also our endometrial cavity in terms of superior to inferior, as well as the measurement between the 2 cornua. Once we do our full thickness sections, we'll also be measuring the thickness of the endometrium and the thickness of the myometrium. So the first section that I'm going to take while grossing this uterus is going to be my cervical section. And so in this section, I'm trying to demonstrate the squamous-columnar junction and showing a longitudinal section of cervix. So that'll be my first cassette, is going to be my anterior cervical section. So now we're going to complete our transverse sections to show the endometrium and myometrium relationship to the serosa. You want to ensure that your slices are going to be between 3 and 4 millimeters thick, so then they can fit within a cassette. So the next step is laying out your slices from superior to inferior to examine your full thickness sections. So now that we have our laid out full thickness sections, we want to be examining the endometrium and the myometrium. So as we move from superior, we can see that there is a white, whorled, and firm nodule. This is a relatively common finding in benign hysterectomy specimens, and these are called leiomyomas. In these cases, I would measure it and submit one section to show representative of this nodule. So in examining the myometrium, I would be describing it as tan and homogeneous, as well as lacy, and this lacy appearance is classic of adenomyosis. So when we look at the endometrium, we want to comment on if it's flat, if it's shaggy, if it's thickened. And in this case, it looks flat. You don't really see a nice row of endometrium on your slices. And that's how I would describe it here. So for sectioning, I'll be submitting 1 full thickness sections to show my intramural nodule, as well as another one to show representative of our endometrium and myometrium. So now we have our representative full thickness section showing our endometrium, our myometrium, and our serosal surface. So now we'll go to take our posterior cervical section to show that squamous-columnar junction. So this here is our posterior cervical section, and we can see that there is one clear gelatinous filled cyst. So in my gross description, I'd be describing this and giving measurements of it. So in this case, the section is too thick, so we'll be bisecting it in order to fit it into the cassette. So now we're going to be taking our transverse sections through our endometrium and myometrium. So you want to lay out your sections from superior to inferior and inspect the parenchyma. In this case, we do see another intramural fibroid or leiomyoma, and we can tell that that is what it is by its gross appearance. And so it's well circumscribed, it is firm and whorled on cut section. So for sectioning, we'll be giving another 2 sections of full thickness to show our endometrium, as well as our myometrium and serosa. So to summarize our cassettes, we have in block number 1, our anterior cervical section. Block number 2 is our posterior cervical section. Block number 3 is our anterior endomyometrium with that intramural nodule. Number 4 is going to be our anterior endomyometrium without the nodule. Then we can move on to our posterior endomyometrium sections. And the 5th block will have our intramural nodule, and our 6th block will be our unremarkable posterior endomyometrium section. So at the end of the gross, we're going to wrap our anterior and posterior halves separately so that if the pathologist has any questions about something they saw on the anterior or posterior aspect of the uterus, they can come back and more efficiently find that suspicious location. So to do that, I like to label my paper towel using a Sharpie as posterior. So then you'll do the same thing for the anterior side. So that's all for our simple hysterectomy grossing tutorial. Make sure that you're going to clean all of your instruments and submit your blocks appropriately.